Welcome to Cutting Through the Chaos, Reframing Public Health. My name is Casey Deems, and I'll be running this CHLI LAPH Dialogue for Health joint web forum with my colleague, Jeff Bornstein. Now it's time to meet the moderator of today's event, Karya Lustig. Karya is the director of the Program Office CDC Cooperative Agreement and the co-director of the PHI Center for Health Leadership and Impact, which runs the National and California Leadership Academies for the Public's Health. Welcome, Karya.
Great, thank you, Casey. I'm pleased to be here today. So to begin with, next slide. Just wanted to take a moment to introduce the PHI Center for Health Leadership and Impact. We focus on building healthy, equitable communities and creating sustainable impact at scale. And we do that through working with communities all over the country, focused on a number of key areas. We focus on strategic work to help them accomplish their community health and population health goals. We focus on building strong partnerships, and we do that through coalitions and team-based programs. And we use an action learning methodology that focuses on the real work people are doing in their communities and how to help them do that in the most effective way possible. We strongly encourage the use of data to help create strong, impactful programs. Our agenda for today, it'll be primarily hearing from our wonderful speaker who I'll be introducing in a moment. And there's a Q&A listed afterwards. We're actually going to incorporate some Q&A time in between the presentation. So definitely feel free to ask questions as we go, and we'll pull up those questions as she pauses. And then we'll also have some time at the end to engage in some conversation. So today's webinar is timely. It's focused on communication and narrative, and we're going to talk about the juxtaposition that we're in with a strong need for public health infrastructure, as well as public health authority being eroded and topics being heavily politicized. We're going to talk about how we could work together to move the narrative in a more productive direction and cover framing strategies that we're all going to need right now. So I'm pleased to have Frameworks here. They're one of the leaders here in this conversation nationally, and I'm really pleased to introduce Julie Sweetland. She is a sociolinguist serving as senior advisor at the Frameworks Institute, where she leads efforts to diffuse the organization's cutting-edge, evidence-based reframing recommendations throughout the nonprofit sector. Since joining Frameworks in 2012, she's led the development of powerful learning experiences for nonprofit leaders and has provided strategic communications guidance for advocates, policymakers, and scientists nationwide and internationally. Prior to joining Frameworks, Julie was actively involved in improving teaching and learning for over a decade as a classroom teacher, instructional designer, and teacher educator. Julie's linguistic research has focused on the intersection of language and race, on the role of language variation and language attitudes on student learning, and on effective professional learning for teachers. Her work has appeared in publications such as the Journal of Sociolinguistics, Educational Researcher, and Education Week. Welcome, Julie.
Thank you, Karya. Thank you so much. And thanks to PHI for pulling this event together. And thanks everyone for making some time in what I'm sure is a very full set of responsibilities to have this important conversation. Karya, if you can pull down your slides and I can start to share mine. Thank you. All right, give me just a moment. And my topic today, as mentioned, is cutting through the chaos. I think that all of us who work in and care about public health have some reframing to do, and I'm excited to be able to share some of the ideas that represent the body of work and recent findings from the research that all of us at Frameworks Institute do. As Karya mentioned, Frameworks is a nonprofit. We're based in DC, but we work nationally and internationally. And our mission is to help folks like you achieve your mission through the power of framing. We work with public sector and NGOs to frame the public discourse on social and scientific issues, which I think of as equipping mission-driven leaders with the skills to lead productive public conversations. And we know right now that many of the conversations that we're hearing, that we're up against around public health are definitely unproductive. whether we are in a context where certain words have been banned from our vocabulary because they're deemed, they're just banned from our vocabulary because of stories about those words, whether public health authority is being eroded, whether, science-based techniques like mRNA vaccines are being politicized and in some cases attempted to be criminalized. All of that has an effect, of course, on our ability to serve the public, promote the public health and well-being, and it has an effect on our workforce, on us, right, as humans and as professionals, as harassment and a general steady stream of negative ideas, right, really are shaping the mental well-being of public health professionals. So this is a difficult and problematic context. I gave a version of this webinar, spoke to some of these ideas a couple of summers ago with PHI, and I think right now I'm really glad to have the opportunity to kind of update and extend and expand on those thoughts. Because when the work gets harder, and if you feel like the work's getting harder, I think you're not alone. When the work gets harder, it also gets more important. It means that this is a time where we need to be very strategic, very thoughtful, and very effective in the strategies that we are taking. There's lots of strategies that are needed to kind of resolve this issue. What we can bring at frameworks, what I can bring as a sociolinguist, is some of the framing ideas, some of the communications ideas that can make this important work just a little bit more effective and hopefully a lot easier. So some things that we know that won't work. We are having some problems, but endlessly admiring the problem doesn't work. Of course, we need a situation analysis. We need to have a sense of what we're up against, but that's only our first step. We have to remember that we can be strategic without being perfect, right? Yes, any strategic response may have downsides. There may be one group it doesn't reach. There may be one or two things that it doesn't feel like, oh, we haven't solved every aspect of the problem. There can be downsides, and it can still be the optimal thing to do, right? The best available option to us right now. I love this quote by Dr. Harriet Breaker, that seeking perfection is demoralizing, but seeking excellence is motivating. So nothing that we have before us when our repertoire is going to be panacea, silver bullet, whatever you may call it, magic wand. But we definitely can be more strategic and more effective by being planful and thoughtful and looking to evidence. Another thing that simply won't work as these conversations get more escalated, heated, inaccurate, divisive, we can't assume that we can stay out of it. Avoiding controversial issues simply is a short-sighted approach. One reason is that a spiral of silence can start when there is a committed and vocal group with strongly held views. As that group, as a constituency, is speaking up in opposition to something or very strident language on something, that can make the existing view, the positive view, seem unpopular, which then can have a chilling effect on people who actually hold that positive, science-based, more accurate view. Soon, all the voices, if the loud voices are all we're hearing, all the voices we hear are on one side, and that itself is making the problem worse. Because the number one predictor, one of the strongest predictors of what people will believe, is the number of times they have heard it. So if all the voices that people are hearing are on one side, that itself skews public opinion and the political climate. So all of that is a lot of social science to say, staying out of it often makes it worse. we can't just jump in and rush in, because we have to really make sure that we're being strategic. If each of us and coordinated, if each of us in all the local health departments or all the NGOs is kind of making it up as we go along and coming up with something that we think, is our best effort for the day, we are leaving a source of influence and power on the table. If our field lacks coordinated framing, then we are not taking advantage of the fact that one of the strongest predictors of what people believe is the number of times they have heard it. Because instead of increasing the number of times people hear a thoughtful, well-crafted response to a problematic discourse, we're all kind of doing our own thing. So spray and pray messaging doesn't work. So what can we do in the face of this? Again, I don't have a magic wand, but I do have some questions and some I think, productive evidence-based answers that can let us make progress, measurable forward progress. So instead of that kind of discourse, we can think about how we can strategically advance conversations about equity in particular in the face of efforts to suppress them. Instead of allowing, kind of just standing, not that anyone's standing by, but instead of just, accepting that a public health authority is being eroded, we can really think about how to shore up public health authority in this moment that some are seeking to erode it. Instead of allowing one of the effects of the pandemic to be a widespread distrust in vaccination, we can reclaim and redirect misinformed conversations about vaccines and other science-based topics. And instead of bemoaning the fact that we are in this moment where it really is having a real effect on workforce, we can really think about how we can stand in solidarity with each other and reap the benefits of solidarity, which is both greater impact and a sense of support, right? Even though we are dispersed as a field in many different places. So I don't have a perfect answer to any of these, but I do have some helpful strategies for each of these. So I'm glad you're here today. All right, so we can think about framing as one key to getting conversations and getting the discourse back on track in ways that really, again, support public health and its capacities in this critical time. So some of the keys that I'll go through today that are about reopening productive conversations and reclaiming the discourse on public health is first to maintain our strong framing fundamentals. Second, to respond strategically when terms are politicized, and I have some ways for you to think through what to do, as a particular word gets a taboo status suddenly. We can look for side doors into contested conversations. And critically, and this is a point I'll talk about repeatedly today, we can organize with allies all throughout these, but we can specifically organize with our allies to deal with disinformation and divisiveness in new and more effective ways. So this is a lot. It's a big topic. I do want to encourage everyone to use the Q&A topic, use the Q&A function as I'm going through, and I will pause after each of these sections to see if there are questions and comments, reactions, experiences that you've had with these strategies. And so my hope is that we'll have a good, robust dialogue today, and we'll have plenty of time for that back and forth. All right, so maintain strong framing fundamentals. Again, framing is the strategic framing is the practice of making conscious, conscientious, intentional choices about what to say, how to say it, where to start, where to stop, what to leave unsaid, what to emphasize, what to avoid. And those choices have a real power, and then they matter because the way that we frame an issue has a predictable, measurable effect on how people respond, how they think, feel, act, what they're willing to do or not do, right, on a particular issue. So sometimes in a moment of extreme duress, continued, kind of activation of our stress system, a genuine emergent crisis, it can be tempting and understandable to leave behind or leave aside, our good habits of communication that we know are really important. So in the time, in a time of distress, it's important that we keep those strong basic framing fundamentals that we know have again a measurable positive effect on how people think. And one of them is to keep the public in mind. Many of these issues that public health is up against are being championed and advanced, right, by a very few set of powerful people, right? So there can be political operatives or specific, officials or individuals that have a public platform that are carrying harmful ideas, harmful narratives. And it can be one thing, there is a time and a place, and there are strategies for changing, right, that person's mindset. And sometimes that will work, but often when people are acting in bad faith, or have motives that aren't about public health but are about some other end goal, changing their mindsets is not going to be something that really works. And so we have to change the context, right? We have to change the pressures on that person, or those groups, right, to make different decisions and to have different options. And so we can't forget that we are often, in a framed contest that is looking, that is a contest for the hearts and minds and understandings and attention of, general public and our tiny publics, the people who are most likely to become engaged and activated on an issue. So remembering that we need to be in ongoing communication, ongoing relationship with our constituencies, with the tiny publics, with our communities, is a framing fundamental that we can't afford to let lapse in turmoil, in tumultuous times. However, as we're going out to the public, we also need to remember that there is no kind of one single dynamic, one shift that we can make. Reframing an issue does not work like this simple switch. It works a lot more like this old thing, which is an old-timey navigation tool called a sextant, used to really, I think these are the official name is doohickeys, right? Little things to fidget and calibrate with to change. So you're really pointing your messaging and your framing in that productive direction toward your North Star. So remembering that frames are sets of choices is one of the things that we can do, a fundamental we can maintain in times when we have challenging communications contexts. So thinking through not just a particular word that is politicized right now, but the whole sets of choices that we're making around an issue. Are we taking a very academic or scientific authority tone that may come off as paternalistic or out of reach for our communities? Can we shift our tone to be more inviting? And would that be helpful? Are we advancing? Are we reporting the same old kind of statistics that can inadvertently shine a negative light on communities that are being marginalized and sometimes scapegoated? Well, we can go back to our framing fundamentals and look for data and look for stories to tell about that data that really point out the assets, the strengths of communities, and normalize groups and their cultural practices that are being demonized or spoken about harmfully or disrespectfully. So my point here is there's lots of different framing choices, and we can work intentionally on all of these as we're going about our everyday communications on the non-politicized issues, which again just creates a smarter public that's less susceptible to spin and misinformation and more equipped to play a strong positive role in our democratic decision-making processes. And so some of those framing fundamentals, I want to refer you back to the webinar series that's available on the PHI website from 2 summers ago. We went through a lot of these, but we can change mindsets when we consistently use strategies like these. Each of these has a strong evidence base behind it and are part of our kind of core toolkit, right, for framing effectively. We can lead with the why. Instead of just saying, this is a matter of public health, we can start out with principles like broad shared well-being, practical ways of solving problems, innovation, the common good. When we start out with principles like that society should be upholding, we remind people of shared values and we orient audiences toward the common good. I can hear some of you thinking, but yes, the common good is exactly what's under attack. Again, if we let that discourse go unchallenged, if the voices are not raising the common good, that's going to skew public opinion even more, away from the common good. So it's important that we are keeping those collective public health values in the discourse. We can build our communications not around problems, but around solutions. When we get specific about what can be done to improve a situation, when we talk about collective approaches for getting at, addressing, problems, intractable public health problems, we establish a productive direction. We invite people to respond to an idea, a specific idea of what can do or what can't be done, instead of a general sense of dis-ease with the issue. So we can make sure that we're advancing again what could be done to improve the situation. We can position ourselves as reasonable partners in an important and inclusive conversation. Instead of feeding into the argument culture, we can have a strong point of view. We can be pushing for very strong public health solutions, but our tone can give a sense that we're inviting, that we want everyone to be involved in the conversation. That's not to appease kind of bad actors, but to reduce my side bias. That once people read a partisan tone or a this side or that side tone, people shut down. They're less reasonable and they're more hardened in their partisan views. And so tone is an important thing to think about. We can use plain language. We can provide background. We can talk about public health ideas in accessible and relatable terms. This is essential to rebuilding trust in public health, and because if people really understand the kinds of questions we're asking, the kinds of solutions we're proposing, the kind of work we're doing, we really are shoring up trust and tapping into people's desire for broad shared well-being. But we can't do that if people don't understand what's going on. So this being plain and clear is really important. And related to that is tapping into the power of how. If you have one explanation superpower, it is explanation. And when we explain rather than just assert or define, we help to depoliticize issues. People start to think through an issue through their own lens, rather than looking to what their team thinks, and that again can build more allies and build broader support for sound policies. So that's a lot. I didn't get specific on these. I got a couple of examples, but again, these are fundamentals that you can look at the Frameworks Institute website or in other resources through PHI. So instead of listen to the experts saying, I've got the science, scientists who conduct research on vaccines overwhelmingly agree that immunizations make children safer, not less so, which says, I know what's right. It can really, make the issue more politicized, send people into that confirmation bias or my side bias. Whereas a simple shift that signals that you want to take people's concerns seriously, even if you don't agree with them, this kind of tone shift can really make a difference. Whether we tend to vote red or blue, surely we all agree that children should stay healthy so they can focus on growing and learning, starting from, again, some principles that can resonate broadly, not because you're gonna just stay there in that Pollyanna moment, but because that sets a tone that allows for people to be persuaded, is really an essential first step. So one strategy. Another thing, as I mentioned, making sense of helping people make sense of what public health does really prevents, it inoculates people from misinformation and spin, accusations of doing things for nefarious purposes or for a political agenda. On the left, we tend to talk like this is true, and pretty neutral. But if people can't understand it, you are leaving the goal, the job of interpreting what that is to someone else who may not interpret it in the way you would hope. So the more we are clear and plain in our language, the less vulnerable we are to being, misquoted, misrepresented, etc. So a very plain language kind of version of this same thing. Well, when we noticed an increase in pregnancy-related deaths, we knew we had to take action, and we started this review program. As simple as that, putting it in terms that really anyone could understand, so that it is more difficult for you to be misunderstood. All right, so those are, again, some of those fundamentals, and there's lots of resources on those. I'm just going to pause. Karia, is there anything interesting or juicy in the Q&A?
Looks like we got a couple questions. So one is, can the term explanatory chain be defined? I think that was sort of at the beginning of your presentation.
Yeah, an explanatory chain is it's like a causal pathway or a causal sequence. So what affects what to what end, and really making sure that you're helping people understand a root cause, kind of how that shapes a place or a condition or a social condition, and then what the outcome of that is for good or for bad. So it's building out a full explanation rather than just kind of throwing a definition at someone. And I think I've got some examples of explanations later on, so I'll say more about that later. Good question.
Perfect. And then another one, which I think you were, touching on and probably will do some more of, but if you want to comment on it at all now, how do you maintain an inviting tone when the audience that you're engaged with is already convinced that their view is the right view?
Yes. Well, carefully, with discipline, and with a broader strategy in mind. So I will say a little bit more about this, but one thing is to remember that often your goal is not to convince or persuade the kind of vocal, vector, the vocal opponent, of your point of view. Your audience is the audience. It's the people watching that exchange. And what you want to communicate is that you are trustworthy, committed to being inclusive, an active listener, the reasonable party and partner in the conversation. And so remembering that, for me at least, that helps. I'm talking to kind of the bystanders, not the person that is opposing me. That helps me kind of maintain that emotional regulation and that inviting tone.
Great. That's useful. Let's see. And then related to the trustworthy source piece, a person writes that frequently when we provide key health information from trustworthy sources, they're countered with the concept of it being misinformation. And includes not only wasted time on dealing with their falsehood comment, but diverts the main message from being out there reinforced and consistent and recognized. Do you have any thoughts on that?
Yeah, such a critical issue. I'm gonna say let's pause on that one because I got a whole section on that, and it's complex and nuanced. So I don't wanna jump the gun on that. But yes, absolutely critical issue. I think the short version to that is, oh man, I'll respond to one piece of that. Pre-bunking the information and responding strategically to the misinformation, neither of those are wastes of time. They are inoculating, right, society from that misinformation and future misinformation. So yes, it is an unfortunate distraction, but it is really, I think, one of the big challenges of our time, and we have to just embrace that reality. So I'll say more about it in a moment. All right, good questions. Keep them coming, and let's get into it a little bit further.
Great.
All right, so responding strategically when terms are politicized. So I've been hearing, we at Frameworks have been hearing from lots of partners that are in states where there have been gag rules placed on particularly education, on the education sector, on what can and can't be taught in classrooms. And the gag rules are typically suppressing content about race and racism, and about representation of people who are LGBTQ plus. And so there are lots of other terms, right? So those two forms of gag rules or censorship efforts, sometimes have had a chilling effect on public health departments. Oh, it's happening over there. And so we want to be careful over here in health. And then, of course, we have a few states and an increasing number of states where terms, where public health specifically, right, has been prohibited from using certain terms. So when this happens, and it will keep happening, when terms are politicized, we have to be ready to respond strategically. This is, um, this is one way that groups can spark or fuel moral panics and fuel culture wars, which particularly at a time of an election or that can have political gains. And so this is a time when we can expect this will happen. So we should be ready for this. If we can predict, we can prepare. I think the most important thing to think about is once a word has been singled out as as a term that needs to be scrubbed from vocabulary, or as a term that kind of reveals something or carries an agenda, think through the ideas that that term is carrying. So in order for you to decide whether or not to continue to use that term, or to, and what other strategies you may need to respond to the politicization of that term. So one is to think about if the idea is helpful and productive. So for instance, the term equity. Is that concept that it is trying to get across the sense that we need to have differential, sensitive, inclusive responses to injustices and to inequities in society? So that's many of us in public health believe that that's a core value, and we want to have that idea guide, right, policy and practice. So if that idea is helpful and productive, by contrast, a term like fake news or critical race theory, as it is, mischaracterized, those ideas that those are carrying, right, are harmful and unproductive. Fake news is carrying the idea that our journalistic institutions are broken beyond repair, and we can't trust, mainstream or vetted sources of information. We can only look to certain voices, who have our, who are on our side. That's an unproductive and harmful idea. So that lets me know that that's a term that I don't want to repeat. I don't want to give that term any more space in public discourse than it's already getting. So first think through, is the idea helpful and productive, or harmful and unproductive? If it's an idea that you want to advance, if it's an idea that is helpful and productive, if you're in a position, if you're in an NGO, if you're in a state where it's, where you have administration support, if you can continue to use that term, but be good neighbors to your allies who can't use it by always explaining what it means in plain and nonpartisan language. Using highly heated rhetoric to defend the term in stark terms, stark language, right, is only kind of fueling, right, the folks that are going to use that information and repeat it in harmful ways. So use the term and offer productive, open, inviting explanations of what you mean by it. If you're in a situation where you can't use the term, perhaps you're in a state where that term has been scrubbed, you're prohibited from using it as a state employee. This is where, this isn't my phrase. I wish I could remember who I got this phrase from, but you may need to change the words so you don't have to change the work. Find a close synonym and continue to explain what you mean in that plain, nonpartisan, de-escalating language. And for all of this, whether you're using it or not, however you're explaining it, make sure you're being transparent, with your allies about why your language is changing, how you're using language, and why, so that you can, again, organize folks who maybe they're in a position where they can talk about health equity in strong terms. They can be they can carry that message in some sectors, maybe while the public health department can't, right? So that organizing and strategizing with allies is going to be critical. If the idea is harmful or unproductive, don't repeat the term. Don't the most effective way to kind of kill off a myth or misconception is not to beat it over the head with facts, but it is to starve it of oxygen. And so, not repeating that language. Instead, that doesn't mean just run away from it. Remember, we don't want to allow the conversation to become one-sided. So instead, you can absolutely engage in the discourse that politicized term is bringing up, but instead talk about the intent of the harmful idea it represents, or the impact of the harmful idea it represents. Make the story about why that word or term is getting politicized, and what you think that will do to public health, to communities, to specific constituencies, rather than getting into a dead-end debate about what it means or what it doesn't mean, or if you're doing it or if you're not doing it. And again, be transparent, be in conversation, be in relationship, and be in strategic alliance with folks who are like-minded, and with folks who are potential supporters. So that's one thing, is think about the ideas the term is carrying. And if necessary, you may need to change your words, not the work. So here's an example, 3 examples of how you could talk about health equity in kind of the most, in ways that are really most forward and direct and closest to what folks have been talking about in health equity for some time, on the first box, all the way to phrasing that does not use the word equity, that does not use the word justice, or injustice, right? And I feel like this is a definition that could be productively and effectively used, even in contexts where where it's really difficult to get some of those messages through clearance, or what it may be. So the similarity here, right, is a explanation saying what we mean. So equity means fairness and justice, right? Defining it and explaining it for yourself, so that someone else isn't explaining and defining it and mischaracterizing it, right, from the opposing side. And then getting to core concepts. So it ensures that person-centered view, right? Valuing each person fairly. It involves ensuring that every individual and group gets what they need to thrive and participate fully in society. What doesn't it mean? Please don't pit equity against equality. I think in terms of our thinking about what we do we take a uniform approach, or do we take a sensitive approach? That thinking is essential in terms of our strategy. But if our communication strategy is to try to beat up on equality, equality is a valuable, positive concept in American minds. It's a cherished ideal. So, understanding the contrast between uniformity and sensitivity is critical. Beating up on the word equality is not our best frame forward, I think. And so what are we trying to get across, right? We're achieving equity because by rethinking uniform one-size-fits-all treatment, we may need to be devoting more resources or different resources in communities that face injustice, that face structural racism, that face marginalization or oppression, to correct imbalances caused by unfair treatment. So absolutely saying what you mean, but thinking about, again, not arguing against another side or misconception, but being clear about what you're for. This middle one, same types of ideas, but it uses the phrase health equity, and it talks about, kind of what it requires and what it involves. And this is written in a way that, isn't advocating for it, but is explaining what it involves. And that is often a space that in state government or government you have to be, right? You can define and explain concepts without advocating or taking a position on them. And then this third one, again, doesn't involve some of those words that may be trigger words or taboo words in highly politicized contexts, but it's got those same core ideas. So I offer this to you, and we just put out a resource on our website, Framing Health Equity, that has this, as well as some more some more language that you might be able to borrow or leverage. And then remember, that the work is much more than the words. And even if you can't say a specific word, there are lots of communication strategies you can be using to advance an understanding of health equity, to advance a more equitable discourse and a more inclusive and respectful discourse, even if you can't talk about that term. So, for instance, how are you attributing responsibility? Are you pointing to conditions, systems, and structures as the root causes of health disparities? Or are you using traditional public health language that makes it all too easy for people to fill in blame and stigma of affected populations? Are you proceeding, crafting your communications as if we have to pick one social group over another to get this right? Or can we counter us versus them thinking and zero-sum thinking by using a broad and generous we? And I'll give you examples of this in just a moment. Are you advancing an aspirational, values-based vision about what health equity would do for us? What the vision is for a society where everyone is thriving and healthy and well, and that means making sure that everyone, like all means all, we're really addressing the barriers that are between some groups and their fullest state of health. Talk about where we can go, paint a positive vision of that possible future, rather than dwelling right in the problem, and only kind of pointing out the problem. So this is a long way of saying, even if you can't talk, you have to give up the particular vocabulary item, there's lots of ways you can still be in common cause and advancing the work of health equity without without a particular word. So a couple of those strategies that I just mentioned. Are you using a broad and generous we, advancing and expanding the circle of concern and really pushing back against zero-sum thinking, or us versus them thinking that some groups are special and distinct and other and them? The first one here I have is around age. The second one is around particular foster youth. The third one is around race and racism. And we can shift here. Each of these are important, vital public health issues. Each of these are advancing policies that are essential supports for groups that are facing exclusion, marginalization, injustice, and inequity. But this language others those groups, and that is not an effective, it's not our most effective framing strategy. So instead of talking about the elderly population, we can talk about the fact that we're all aging, right? We need ways to stay connected to our communities as we age. This is all of us, right? Not them. Sure, transition age foster youth require supports upon their 18th birthday, but can we use more universal, humanizing language? We all need support in times of transition, and our young people in foster care are no exception. On the left, the troubling and persistent and often increasing statistic that Black women are up to 3 times more likely to die from pregnancy-related health complications than white women. Yes, and that requires attention, but can we talk about a universal principle and then show how it's being violated for a particular population in ways that are togethering, not othering? So every expecting mother should receive safe, respectful maternity care. We need to pay attention to the fact that women of color and rural women can't count on this, and make sure that they can. So that's what I mean by using a broad and generous we. Attribution of responsibility. Who's responsible? Who's to blame? What's the cause of this? And so instead of missing attribution or blamey attribution, individual attribution, we can really point to systems and structures. So here on the left, I've sometimes gotten feedback that this example is too out there. No one would ever say it like that, but I took this quote from a major media source in just the last couple years. And so every year, roughly 3,600 babies in the US die suddenly for unknown reasons. Researchers estimate that if expectant moms would just quit smoking, we could prevent 800 of those deaths. So very squarely, right, placing the onus and the blame, just quit smoking. That's a strong presupposition cue. It's indignant, right? It's just disbelieving, right, that they would do such a thing. In public health, we might not say it just that way, but I have seen plenty of state public health websites that say, preventing smoking during pregnancy could prevent, right, X number of deaths, or X number of improve birth outcomes in this way. So we can instead think about, what is the public health intervention that we would want to advance, and how can we show that the system has an affirmative obligation to do that thing, right? Not just talk about the population that's experiencing a health issue and pointing to a proximate cause, but getting deeper into the system. So researchers estimate that if we just connected expecting families to treatment for nicotine dependency, we could prevent 800 infant deaths a year. So pointing out that there is an effective solution to this, that the system is failing to take. Reframing the problem from the behavior, right, to an underlying cause, nicotine dependency. This could be even framed even more strongly, even more systems, but I wanted to kind of keep it parallel. How would you talk about that same topic in ways that really are pointing to this? So again, neither of these, if you're in a spot where you are taking a health equity lens on all your programs and areas, but you can't say the E word, right? This is health equity framing, even though, without using that term. In general, we can ask different questions. We can think about the data and the stories we're telling in ways that are attributing responsibility to systems, to structures, and to forms of oppression, and looking for forms of liberation. And this makes, if we are collecting our data, asking our questions, sharing our information, developing our strategies with these kinds of systems attribution questions, it becomes the programs we're doing become administration proof, right? These are baked into the system. So instead of, on the left, we have very traditional public health questions that kind of think about how we would craft a communication. Well, how do experts define this topic? Who's affected? What are their risk factors? What are their protective factors? What should we do about it? Because we have the evidence base, and how can I shine a light on that particular spot where that has worked? And again, I don't mean to suggest that these are wrong or bad, or we need to abandon them. We do need to think about, are they are yielding answers and information, but they are not necessarily attributing responsibility to systems. So we can reframe our questions. So instead of just saying, what is the topic? We can ask, how is this topic a matter of justice and inclusion and belonging? Instead of just saying who's affected, we can think about which groups are harmed and who is benefiting from this, which often leads us to a different set of strategies. Instead of just thinking about traditional risk and protective factors, we can really ask ourselves, what's uneven, what's unjust, what's unfair, and how are those causing this problem? And how do powerful groups protect themselves from this risk? We can not look at only what's evidence-based strategies, but being very specific, disciplined, streamlined, focused on strategies that would eliminate disparities, not only create overall improvements. And yes, of course, we want to know where proven strategies have worked, but we should also be thinking, who leads communities in this work? Often, at that community grassroots level, we are seeing emerging strategies coming from the lived experience of communities and their assets and wisdom that can really point us right to the next generation of promising and hopefully soon proven strategies. So again, not saying we should, need to abandon the traditional public health questions, but we absolutely should be adding sharper equity focused questions to our repertoire. All right, I'm going to take a breath. And ask Karia, I saw a lot. Thank you for all the emojis and reactions. It's very affirming. I can't see faces, but it's nice to see some reactions. What are folks thinking and wondering in the Q&A?
Lots of great questions coming in. I'm trying to kind of group them around topical areas because there's so many good topics here. So the first one's around sort of highly charged issues right now. A bunch of different versions of this question came in, but I'll focus on one in particular around transgender care being highly politicized, just as an example of one that people pointed out. People using misgendering terminology and just highly politicized and hurtful comments, and wondering whether is there a point that you can't have conversation or a way to approach those kind of conversations when people are being specifically hateful in the way that they're approaching a topic.
Yes, I hope, and I don't think this question assumed that, but I just want to be clear. I am not suggesting that we are kind, nice, to folks that are being actively hateful and harmful, right?
Mhm.
I am suggesting that that coming and maintaining a reasonable stance, a reasonable tone, is a powerful intervention into the discourse itself, right? My intention for doing that is not to make the bad actor feel good. It
Mhm.
is to insist that our public conversations are productive and oriented towards peace. Nor am I'm not suggesting that civility is required in each and every conversation, right? That we have to kind of just, keep our mouths shut, bite our tongues because we don't have anything, we don't have anything nice to say, don't say anything at all. I think there are times when we absolutely need to call out harmful, unjust, dehumanizing language. But I know that there are ways that we can do that in ways that, again, that protect the public discourse and keep it in a peaceful kind of space. So instead of accusing someone, right, you are using dehumanizing language. You can say, "I'm concerned." Right, speak from the I position. I'm concerned that by referring, to my colleague by a name that they don't wish to be called, we're sending a message that we don't care about people's individual rights and humanity, right? Please call her X, right? And ask for what you want. So speak from the I perspective, name the problematic strategy, and ask for what you want firmly but politely. Call her X, right? And so, that sort of thing. That was a bit off the cuff. I hope that was clear. I'm happy to take clarifying questions or comments, or if somebody's got a better way to say it than what I just said. But again, this is not an appeasement strategy. It's a peace building and strategy, but it's about waging peace, right? Not just kind of keeping the peace.
Excellent, thank you. And then another one, when coalition building necessitates partnership, for instance, with a group like law enforcement that often deploy an explanatory chain that might be really different from the way that public health would address an issue. How do you recommend balancing the tone and redirecting messaging in a way that maintains collaboration but addresses their way of doing things?
Yeah, that's a hard one to answer without a kind of specific topic to tie it to, but it made me think of an example where we were working in a Western state with all Republican-led government, and that state was working on safer syringe strategies. And law enforcement was going to be a critical critical partner in that. Law enforcement, frankly, could make or break those harm reduction sites where clean syringes were being distributed to people who use drugs. In that case, we advised and worked with public health partners to be clear, to have some strategy to clearly communicate the benefit to law enforcement, right? That when folks have can dispose of used syringes safely, it's less likely that they've got a used needle in their pocket as you're patting them down, and that can prevent that. Right. So to really communicating the benefits to that constituency was one strategy for doing that. Also, simply asking rather than telling, asking for new language and new ways of thinking. So in that case, they were talking about, we're going to talk about syringes, and safer syringe services, not needle exchanges, and they asked law enforcement to join them and support them, right, in using this more inclusive, less stigmatizing language. So I hope that's helpful to
Perfect.
folks. And if there's a
Yep.
more specific topic, I might be able to give a better, more crisp answer.
And I actually think the question was about that exact topic. So that's
Oh, really?
perfect. Thank you.
Okay.
We do a
Well,
lot of work at
Mhm.
CHLI with coalitions around harm reduction and other areas related to reducing overdoses.
Ah,
So I think that that's related to that. So and I guess the third one to focus on during this question time would be around, there was a bunch of comments that kind of came under the concept of public health being categorized itself as being woke, and kind of put into that category of like left-leaning politics. So although it's not political and we try and move it away from that, sort of the local politician. Well, there's a few different questions. It's the woke part, and then that local politics and now Congress kind of the politics and the policies that drive public health are politicized by sort of who's making those decisions in communities. And then that further characterizes public health itself as being kind of woke and part of
yeah.
that left-leaning group.
Yes. So I think that there's a few things that we can do to push back, I guess, or navigate the politicization and mischaracterization of the idea of being woke and that being a bad thing. So one thing is to be in conversation, relationship, and allyship, right, with communities who may find that an issue of concern. So it's, if people are calling you a name that you just know you aren't, right, it's much harder for others to remember, to believe that if they know you. And so, again, thinking about public, engaging communities regularly, consistently, is kind of one of the most powerful inoculation strategies we can have against whatever the mischaracterization of the day is. So that's a longer term strategy, but one that you can't afford to wait on. So if you're not already doing that, please do that. The second, I would treat woke, the accusation of woke, as an example of misinformation. And I've got some strategies for that. So I would treat that word like that. And I mean, I think the point I made before is the idea that it's trying to communicate harmful or helpful, in its original meaning, of conscious and attuned to hidden attempts to cause harm or oppression, right? If that's the original kind of like, just conscious and aware of what's going on, that's a helpful idea. The idea it's trying to communicate now is out of touch, out of step, and out of touch with what people really want, and kind of too far away from certain understandings of traditional American values, right? And that is not a helpful idea. So don't repeat the term. I would not be, writing op-eds if I'm at a nonprofit, just kind of saying what's wrong with the woke discourse. I could talk about that issue, but I wouldn't be repeating that term, and then I would treat it like misinformation, because it's simply not the case that public health is far out beyond, right, kind of where people's expectations and needs are for health and well-being.
Great. And then just a couple comments on the reframing that you were showing. So one person said that they've seen Dr. Fauci use similar strategies. Great. And you articulating what they observed, which they really like to see, and thought that their division really needs to watch it. And then another person saying the reframing of Black maternal mortality, in their opinion, is damaging to the people impacted by it. The statement generalizes the adverse experiences of Black birthing people, and they felt like the message that you reframed didn't feel positive for the people directly impacted by it, that it seemed to feel dehumanizing.
Well, that was not my intent, but I accept responsibility for the impact if that's how that commenter experienced it, and I will look at this again. I think what I was hoping to communicate here is that if we simply communicate the statistic about a group that that the language here says is other, right? This is kind of written from a above the fray kind of supposedly objective stance, and that this population is experiencing this, um, uh, is that invites people to lay blame at the people who are experiencing that problem. And my intention was to show that we can give if the one that's on the left, yes, the one on the left is what I was reframing. Okay. Yes. Okay.
Yeah. No. I think they might have miscued
Okay.
the
Yes.
part there. And then one last thing that just came in about the term woke. They're wondering whether it would be useful to pivot to public health purpose. For example, we exist for the health and well-being of all residents so that we can blah, blah, blah.
Absolutely. I mean, I think pivoting in general, by which, that word gets thrown around a lot now, is like change the subject, or I'm not sure people know what it means anymore. When I, as a communicator, as a communication strategist, when I think about pivoting, what I think of is the original kind of metaphor of, you're in basketball, you've got your foot, you firmly plant it, you know what you're doing, and you have swiveled, right? You have moved to where you want the ball to go. And so, if somebody is throwing woke at you, the idea isn't chase that bouncy ball, and go where it is, but where do you need to go? And I think what the commenter said, which was, you don't say, we're not woke, we're just the government, we're just doing what we're supposed to be doing. Like, that's not helpful. It's saying, thank you for your comment. I know what, the people I work with every day, what we're working on is ensuring that everyone is protected from harmful exposures, that everyone has access to a healthy retail environment, that healthcare is widely accessible, affordable, whatever it is you are doing, and just, move to where you believe the conversation should be going, return to your core story, rather than chasing down, that distractive and divisive concept. Okay. All right, let's keep the conversation going. I got two more big ideas. This one is about looking for side doors into contested conversations. I think it goes to the issue of pivoting, which we were talking about a little bit. Sometimes we, certain topics have been long politicized, and people have, because of that, right? Many people have a position, simply because it's the position of other people, right, in their social group, whether that's a religious identity, a political identity, a geographic identity, other, kind of whatever they're thinking of as kind of their team, right? At that point, people are relying on that my side bias, right, to kind of shortcut and say, oh, my people think this is what I'm going to think too. Anytime we are entering a conversation through that same door of, this side versus that side, we are making our work harder. So side doors are ways of getting into the issue that are unexpected or even just different angles on the topic, so that you are, again, not tipping your hand or tipping the conversation towards one political stance, or ideological stance or position on an issue or another. So in our work on climate change, we worked with partners to change venues, right? So let's take the issue out of, not that we take it out of, we advanced a conversation about climate change with partners in zoos and aquariums. So this is a place where people are going to learn, where they are trying to communicate, and demonstrate values and interests to children, where they're in intergenerational groups, which again, makes people act and talk in certain ways, less likely to get into heated, debates if your grandparents and your kids are around. And so that changing the space, changing the venue, right, allowed that initiative to have 125 million productive conversations, right, about the impact and the science of climate change over the last number of years. So a side door can be a different space. It can be a different entry point to the topic. In work that we did in partnership with the Missouri Foundation for Health, there's a real conscious and conscientious effort to frame conversations, to frame efforts to improve safety from guns by focusing first on the issue of suicide and suicide prevention. Most of the deaths, from firearms in that state and in many states are not homicides or accidents, but suicides. And so framing the issue, starting the conversation, making the conversation about mental health and well-being, threats to mental health and well-being, mental health crises, and the lethality, right, of the presence of a gun if used in a suicide attempt, right? That allowed a very different set of folks to get into the issue and to align with the issue. It allowed a very different type of conversation. So these side doors, sometimes if you say, oh my gosh, I can't even think about how I would raise that topic. I mean, I think the transgender conversation, in some places you may, feel that because of the heated rhetoric and the intractability and sheer hatefulness, right, of the conversation. But is there a side door that you can get into that contested conversation far away from the boxing ring? So we did a similar strategy recently on childhood vaccination in partnership with the American Academy of Pediatrics. Overall, we found quite a few side doors into this issue, which, as you know, has been, really been a quite unfortunate kind of conversation about vaccination, even before COVID-19. So we found that many of the strategies that the field had been developing and using in order to kind of make the strongest possible case for why this is the most scientific, wonderful public health intervention ever, were actually kind of reinforcing people's, people who lacked vaccine confidence. It was reinforcing their sense of, wait, if you're trying to make that kind of argument, I want to run to my corner with my people. So we found some different ways of entering the conversation. One was, instead of telling a story about disparities in uptake, to start to tell a story about our shared responsibility to ensure access for everyone, for everyone to be able to access childhood vaccines. Instead of kind of emphasizing a safety frame by talking about how important it was to protect children from disease, we found that pivoting the side door of talking about the health as a platform for childhood development, that whatever a child's developmental milestones and tasks are, whether the child is 18 months or 16 years old, right, a child has to be healthy and well to run, to play, to jump, to learn to play their instrument or their sport, whatever it is they're up to. That was the opening space. The protection from disease, either kind of people already know that, or it gets them into that safety frame of mind, which then sends them into that weighing the supposed risks of vaccination, against the supposed risks of encountering, right, a disease or becoming seriously ill with it. So that protection brought a conversation about safety, which brought in that risk thinking. Whereas the side door is that preparation for healthy development. And then shifting the frame, shifting the emphasis from how vaccines fight disease, instead for the vaccine itself, to the immune system, how immune systems prepare themselves. So a couple of examples from this. So removing the practical barriers to access, we think, is an important, different way of entering this conversation. People don't see the practical barriers to families getting fully vaccinated. They assume that because vaccines are, largely required for school entry, they're also free and freely available, and don't see the practical barriers that might prevent a family who wants to get their children vaccinated from following the full recommended schedule. Work hours, clinic availability, location, etc. So talking about removing the practical barriers to access opens up the conversation. Make sure that vaccinations are widely available, easy to find, affordable to everyone. Whether this means changing clinic locations or changing insurance reimbursement policies, we need to remove the barriers that families run into when trying to get kids vaccinated. You could go on and share information about the specific barriers that specific, cultural or geographic groups encounter, right, in getting their children vaccinated. But this is a very different story than kind of talking about differential rates of uptake. It's differential access is a story we find is going to be more productive. And then we found that it really mattered to talk and how to talk about what we should do. So we tested 3 versions of kind of saying we're messing up the access. We are failing to get vaccinated. That was not a productive message. We as a society are failing to provide access. That was not a productive message. But we have a responsibility to provide access. And here are some ways that that's not happening. That was a much more productive message. The other kind of side door we found into this is to stop insisting that vaccines protect children, and instead focus on how they equip the immune system to respond. We tested a few different metaphors for this, and the one that we found that was highly productive was comparing the process of a child's body gaining immunity to the process of gaining literacy. This had some unexpected but very cool frame effects, this metaphor. So, typically we found the public was the vaccine hesitant public, or even people who got, were pro-vaccine, but they would think about like, well, the recommended schedule for early childhood, seems like a lot for a little body. Should I slow it down? Should we slow it down? That reasoning is thinking about the vaccine almost like a medicine, and you're worried about overwhelming a little body with too much medicine, and so we needed a way to get people to think about earlier was better, and the more the better early on. Literacy brought in that sense, you can't really start to read to kids too young, they need some sort of thing. We also found that this metaphor helped people pivot in their minds from yes, a vaccine is good for the individual, but it's also good for society, right? That kind of common good idea. The example of this metaphor, as we tested it, one of the methods that we used, the study overall included close to, I forget right now, it's 10,000 or so Americans. I will look that up to get it right. But thousands of folks were in this study. We tested it in a large scale randomized controlled test for framing through a survey experiment. We also did some on the screen interviews where we would interview folks, ask them about their habits, their beliefs, their thinking about vaccines, and then give them a very brief exposure to the metaphor, something just like what's here on the screen. It's a lot like helping them to read. Vaccines are beginner texts that our immune systems use to practice comprehending a disease. And with that literacy, their bodies can read a disease more quickly when they encounter it and respond and resist right away. So I'm going to show you in the next on the next slide a video of one of those interviews. I don't want to overstate, the one interview, in the context of a study that had thousands of data points. But I do want you to see, so I wouldn't suggest that everyone responds this way or that it always works this way, but I do want to show you that it can work this way. So this clip is about 1.5 minutes long, and it offers just a snippet into how this metaphor can shift thinking. So you'll see her thinking before and her thinking after.
I personally have not been vaccinated. I did have, the latest what we're discussing. What's been going on in the world about COVID. So I have built up antibodies. Explaining how it works is basically having the health system incorporate certain medicines, I guess, that can combat together. The risks, I would think, is kind of like what's going on now, even though, you know, people have had their second shots, and now because of the new strand, now they're getting boosters. So, okay, so now you had Delta, now you have Omicron. I mean, what else is going to come? And you're just going to have to keep boosting and boosting and boosting. Whereas before, like for, let's just say the flu, you know, I just get one shot for a year. I don't get a booster. Of course, I don't get the flu, but that doesn't necessarily mean that the shot worked. And because I haven't been vaccinated, I can't really say that I'm at a big risk. I've been doing pretty good without it. It makes sense that it's just like reading and writing. It's just giving you the ability to increase your knowledge, your body's knowledge. So your body is getting more knowledgeable as like in reading and writing. As a child, you're growing in what the aspect is of your body. So your body is growing in knowing, you know, that it's getting better in deciphering what the benefits are. About the risks, God, kind of looking at that, I really don't see that there's any risks. Your body is like the student, and the vaccine is like the teacher giving you what you need to learn to read and write. That's pretty interesting.
Okay.
I really kind of like that aspect.
Okay, all right.
Kind of got my mind kind of going differently about this vaccine.
Okay.
Just shows that with the right metaphor, with the right choices, with careful and strategic choices, you really can break through preconceived kind of positions and make a real difference in people's thinking. So I recommend not just that metaphor to you, but the whole report that offers, and the toolkits that go along with that that you can find on our website to really dig into the vaccine messaging. All right, final kind of point here, and we've talked about this, you know, I think a few times now, is to organize with allies to deal with disinformation and divisiveness. So when, you know, we are getting a term or that's politicized, or a group that's being singled out, there's some things that we can first do no harm, and then some strategies that, you know, are emerging as, you know, best practices and promising practices. So one is to avoid some predictable communications traps. I think in the early days of the time, in which Fox News in particular was repeating and trying to repeating the term critical race theory and attaching it to a definition that did not reflect its kind of its origins. In hindsight, we can see that some different responses from folks who are fighting the good fight on inclusion and equity could have been better if they had avoided these predictable communications traps. So first of all is don't react before you reflect. Once misinformation or a misdefinition, mischaracterization, a divisive kind of harmful trope is on the move, you have to respond strategically. It is human nature. If I say, schools are teaching critical race theory, for the school who has never even heard of critical race theory to say, I've never even heard of that. I had to look it up. It's a framework taught in law school. We're not doing that, right? That is a natural human reaction. But we have to be quite strategic about responding again to these sorts of situations. And so taking a breath, pausing, and thinking about what is the highest and best use of your limited communications opportunities in the face of one of these kind of moral panics or thing is really important. Two of the things we know should be part of that strategy is not restating myths or misinformation. Repeating misinformation often reinforces it. Again, a strong predictor of what people will believe is the number of times they have heard it. So if you repeat it, even to debunk it, you have just given that one more rep. So don't do that. And don't get into dead-end debates about the correct definition of a term. For one thing, that's not the highest and best use of your limited communications opportunities. You didn't wake up that day hoping or wanting to talk about critical race theory or gender affirming care or whatever it may be. But also, you have other things, right, that you were trying to advance on that related issue. But the other thing it does is it gives the impression that there are two sides to a valid argument. The whole point of these disinformation campaigns, right, or one of the pernicious aspects of them is to create an argument. It's a manufactured controversy. So you want to avoid that impression that there's two sides to this. You want to think about what you're doing. So one thing is to make sure that you're not coming off as correcting folks or wagging your finger at them. I've seen this quite a bit in the vaccine space. It's because science, people, that sort of thing. When we try to counter that misinformation with paternalism, the sense that we, the educated, noble, powerful, right, know what's best for you, the folks who have been misinformed or just haven't read up enough, that is further eroding public trust in institutions and evidence. So it's really critical that we are showing that we are that old adage, that people have to know we care before they care what we know, that we're really making clear that we are working in the public's best interest, that we care about the people who are being affected by this, and that we are in partnership with them rather than fixing their thinking. And so in terms of what to do and when you are kind of encountering one of these disinformation or divisive kind of moral panic or misinformation mobilization, first of all, as we talked about before, set your intention strategically. In most instances, your goal shouldn't be to convince that vocal vector of disinformation that they are wrong. It's to inoculate others against their harmful ideas. And if you think about what is your communication going to do to the surround sound, right? Not how do you counter that person? How do you create the surround sound that your issue and your constituencies need? Think about that. Then, as you think with that in mind, you need to prepare key messages that keep things simple. State the truth or the most truthful thing you can say in clear, concise terms. Those simple messages, I think that's one thing that came very clear through the pandemic is shorter and true is better than longer and true. But then explain why it is true and why you believe it to be true. Point to the evidence base, pull back the veil on it a little bit. And then pull back the veil on the disinformation strategy. Name the disinformation strategy. Maybe it's scapegoating, maybe it's cherry picking the data, maybe it's a personal ad hominem attack. Name that strategy and worry aloud about its impact. What this does is it doesn't restate the misinformation, but it gives people a memorable way to make sense of the misinformation. So they understand why the disinformation is untrue and why that tactic matters. So, sometimes we see this sort of strategy happening in partisan political discourse, kind of MSNBC versus Fox. Most of us shouldn't, and probably couldn't take that tone. But you can make the same kinds of points of why is the disinformation vector doing it and what's the problem with it in ways that are appropriate for a public sector employee. So a couple of examples like this: the untrue messages that some are repeating are based on taking a data point out of context. And I worry that this is misleading people and reinforcing harmful stereotypes, about this group. or personal attacks and accusations distract us and add to an atmosphere of suspicion. I would rather see a careful consideration of ideas that can lead us in a productive direction. So that's, naming the disinformation strategy and explaining why it's harmful in a way that really demonstrates your care and concern. Overall, you can't do what's on the left to kind of call back to my mini arrow projects or my mini arrow image. Instead, a few simple key messages that point people in the right direction and the same direction. All right, that is my all my prepared comments here. We've got more comments if people have reactions and questions. And then Karya, I think you probably have some other things you want to do housekeeping wise before we close up.
Excellent. Thank you so much. An amazing presentation with all the little positive reactions there. I love that feature of Zoom. So thank you, everyone. We are capturing all of your comments and questions, so feel free to continue to post them as I'm closing us out here. We will capture all those and share those with Julie so that she has them. We're glad that you have found this valuable. Her contact information is on the screen right now. And then if we can move over to our closeout deck. Great. So we just wanted to take a moment. This webinar is brought to you by Dialogue for Health and is sponsored by the National Leadership Academy for the Public's Health and the Center for Health Leadership and Impact. We'll be opening applications for a National Leadership Academy for the Public's Health. This program is funded by the Center for Disease Control and is a wonderful program to help bring teams of leaders together, multi-sector teams that represent public health and their partners to help do work in communities all over the country. The program is competitive and available in all states and communities. It can be local, it can be statewide, and it just includes one person from public health and other partners that you work with. It's issue agnostic, meaning that you can come in with any issue in public health, and we highly encourage you to apply. The applications will be going live in August. Next slide. The learning model helps bring together topics like Julie talked about today around leadership, community health, and partnership skills and systems and political leadership. It focuses on data and continuous quality improvement and strongly embeds health equity into the program and all approaches and all parts of the program. Next slide. So we have 2 information sessions coming up if you're interested in learning more, one on August 3rd and one on September 11th. The same information will be shared in both information sessions, and we welcome you to come and learn more about the program there. Next slide. So thank you all for joining us. Our contact information is on the screen. And again, we'll capture all the wonderful comments and questions that came in so that we can share those with Julie, since we didn't get a chance to touch on all of them. Thank you all so much and hope you have a wonderful rest of your day.